Today we'll be looking closely at what it means to live with heavy flow during your periods. A woman who starts her periods at 11 years and reaches menopause by 48 years will have bled for the equivalent of a daily bleed for 6 years, assuming she has a menstrual cycle with 5 days of menstrual blood flow per month. 6 years daily bleeding. Imagine if she also has a heavy flow during these periods. If it were a problem that men faced, we would probably have heard a lot more about this, but we have to speak about it because too many women still live with heavy periods, not realizing that it is not usually normal and in many cases it is treatable. Women with heavy menstrual bleeding go through many physical, mental and emotional problems directly related to their menstrual blood flow. These problems also go on to affect other aspects of their lives. So first, let's talk about or define what does heavy flow during periods actually mean. Now, it's also known as menorrhagia, and it is different for every woman who experiences the problem. Yes, we can specify a particular volume of blood that is considered excessive. Generally, this is about 80 mils of blood in a month. On average, it is thought that most women lose 30 to 50 mils of blood through their periods, which is about 2 to 3 tablespoonfuls. But for comparison, on average, and for someone who is having excess blood, this is about 80 mils of fluid. Many women who suffer from excess blood flow during periods may even lose a lot more blood than this in a month. However, we are all different shapes and sizes and concerns. So this volume may be heavy or light for different women. So what doctors feel is more useful is to use the impact or degree of disruption or distress that a woman's bleeding causes her to determine whether she has heavy menstrual blood flow or heavy menstrual flow during her periods. If you have menstrual bleeding that lasts more than a week, are using more than one pad or tampon in an hour, or emptying your menstrual cup more often than is recommended, if you need to use a heavier or double protection to control the blood flow through to your clothes or bedding, if you are passing large blood clots, larger than a 10p sized coin or a coin about this size. Blood clots are fleshy pieces of congealed blood that usually indicate a woman is losing a lot of blood in a small period of time. Or if you experience tiredness, fatigue, weakness, or shortness of blood during your periods, then you have a heavy flow. But there are a few occasions when a heavy flow can be normal. When you first start having periods where things are still a little bit irregular, your body and hormones are still trying to adapt, just after having your baby, or as you enter menopause, when again your hormones become irregular. Other occasions, it could be due to several medical conditions such as fibroids, endometriosis, a sexually transmitted infection, or other problems. So please check out my video here where I talk about at least 16 different causes of heavy menstrual bleeding. Before we talk about the complications, let's take another look at the impact that heavy blood flow can cause in terms of population size. According to the UK-based organization, the Women's Health Concern, 1 in 20 women who menstruate have menorrhagia. That is a sizable proportion in any population of active mothers, sisters and daughters going through this problem. Now, what are some of the direct effects of having heavy blood flow during periods? Number 1 is anemia. Now, the loss of excess blood means the loss of iron from red blood cells in the blood. This leads to a condition known as anemia. There are many types of anemia, but with menstrual loss, you have iron deficiency anemia. And symptoms include feeling tired, weak and dizzy. You may also find yourself breathless or experiencing chest pain. Number 2, low blood volume. Remember we said that the average woman may experience the equivalent of around 6 years daily bleeding, assuming she has periods from the age of 11 to around 48 or 47 when she goes into the menopause. And imagine this woman having excess blood flow on top of all that. A possible outcome could be the risk of losing so much blood it affects her blood volume, leading to a problem known as hypovolemia or low blood volume. This is a potentially dangerous condition. You may have a fast heart rate, a low blood pressure. You may also feel dizzy and breathless. If any of these is going on, you must seek urgent medical attention. Number 3 is pain. The presence of excess blood in the womb can make the womb bulky or heavier, putting pressure on the womb and the other organs around it. The womb muscle is also cramping in order to shed the blood and the contents inside it. All this contributes to general ache and discomfort, and it can be further complicated if the cause is because of problems like fibroids, endometriosis, and some of these other conditions that we've talked about. Number 4, poor sleep. Because of pain and discomfort, you may not get settled sleep. This in turn will affect your energy level, making it difficult to focus and concentrate at work and school and so on. 5 is complications from treating the cause of the heavy bleeding problem. Thankfully, this is not so common, but it does happen and is very sad. I recently treated a young lady about 37 who had surgery, which was the removal of her right ovary in order to treat the condition endometriosis that was causing her to have heavy periods. After her surgery, this lady suddenly went into menopause, premature menopause, in her 30s. She didn't have any children at this point. So she'd started off with a condition causing her to have heavy periods. She went along to get it treated and then experienced this side effect of the treatment. And so it is rare, but it can happen that women may experience even more challenges as they endeavor to solve the problem of heavy periods. Now, what about the mental and emotional effects of heavy blood flow or menorrhagia? For those of you who read the Bible, consider the lady with the issue of blood. And for those who don't, this is a lady that we encounter in the Gospels who had been suffering from blood loss for 12 years until she encountered the Savior and was healed of her condition. So some of the mental and emotional problems that women may experience with this condition, particularly given the culture, given the degree of awareness or knowledge of people about this condition, can include problems like a low mood or depression, anxiety, a reduced or decreased libido or sex drive. And make sure you check out my video here where I talk about the possible causes of low sex drive in women. And another problem that women can commonly have is low self-esteem, which can affect their ability to make or maintain or keep stable relationships. Okay, so next we're going to talk about the indirect effects that heavy blood flow can have on women. But before we do that, I want to ask, do you have or do you know somebody who is living with heavy menstrual bleeding? Can you relate to some of the things I've talked about? Please share your experience in the comment section. And this will be an excellent time to like this video if you're getting some value from it. Okay. Now the indirect effects. What I call the indirect effects are the practical activities of daily living that are affected by any of these physical, mental or emotional concerns that women with heavy menstrual bleeding go through. They include issues like missed work or social hours, being unable to have a social life. You find that some of these ladies may avoid going out altogether because they are worried they may be embarrassed by blood flooding through to their outer clothing, being unable to carry out physical activities like swimming or running, or being unable to have a sexual relationship with your partner because you're either always bleeding or you're in so much pain because you have heavy bleeding and so on. If you have to go out, there's an essential outing that you can't avoid, then you have to plan it thoroughly, make sure you've got double and even triple protection to avoid the chance of being embarrassed by your blood flow. What about the time spent trying to get help to solve the problem? That might mean going to see the doctor, that might mean looking on the internet or talking to people looking for some help or trying to get assistance. That can take a large amount of time for some women. There is also the economic cost of care. For example, in parts of the world where healthcare is not free, where you're having to pay for consultations or to have tests and different medication or operations to treat the problem. And of course, the cost of the sanitary items, for example, the tampons and the pads or the panty liners that you need to get because you need to use double or triple the amount that an average lady might need to use. It is so clear that women with this condition need to know that it is not normal and encouraged to seek help promptly. And getting a diagnosis is another area that might be a challenge. I also want to hear from you. If you have or have had heavy flow during periods, did you struggle to discuss the problem with your family or friends or doctors? Did you find supporting and understanding listening ears, or was it a big challenge Perhaps you were told, well, this is how it happens, or this is the lot of women, just shut up and put up with it. I would really love to know if you're willing to share your experience with us in the comment section. Well, in this video, we've discussed some possible causes of heavy menstrual bleeding. I know you'd like to learn more, so please head over and check out this video here where I talk about the possible causes of acute pelvic pain in women, another common problem that women sometimes don't realize they don't have to endure. Don't forget to give this video a like, and I'll see you in the comments.